Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. I apologize for the echoiness of this room. I'm coming to you live from our brand new workout facility here in our unit. So welcome to this edition, and in this series of Integrative Movement Insider, I've been discussing the importance of balance, right? We all know that balance is important for our older clients, and I've been sharing with you in this series strategies to improve your client's balance. Actually, these strategies work instantaneously to create, or I should say work quickly to create instantaneous changes in your client's balance. So you can use these strategies to dramatically change your client's balance and also set them up for success, because we know that even if you can increase your client's balance right away, it still requires them to use a strategy that they can progressively use to improve their balance, and work on strategies and developing a system for improving their balance over the course of weeks and months and ultimately years. Because balance is something like breathing. You never have to stop working on it. It's never not important. And many of our older clients, because they've allowed their balance to be challenged so much, they need to have strategies that they work on specifically every single day to improve balance. So I want to share with you one more key component, because we've talked about the foot tripod and its importance to balance. We've talked about the knee and its importance to sort of shock absorption and how it relates to balance. We've also talked about the hip and how to improve hip function, hamstring length, and how optimal position of the pelvis is such a key to balance as well. Hey, my buddy Damien's watching. How are you, buddy? Coming to us from Pennsylvania. Hey, Raul's on. He's coming to us from India. Raul, how are you, my good buddy from India? I've never met him, but we know you very well from our Two Anatomy Geeks series, which is starting here again in the fall, so thanks for being on. Damien, my buddy from, actually my best friend's brother-in-law out in Pennsylvania. So thank you guys for being on. Thank you for being a part of our community and for all you do for your clients. So I wanted to add one more component to improving balance, and that is rotation. Actually, I'll be discussing rotation here on Saturday. My buddy Robert Lincoln and I are doing a 2-hour webinar on training the older client and using exercises to improve their activities everyday life. And walking is one of those activities. Balance and walking going hand in hand is one of those activities that our clients are doing less and less of, especially in quarantine, because so many of our clients aren't leaving their house. Like my client Joel, for example, he's left his house twice in basically 4 months, or since lockdown, April. So we're talking like 4 to 6 months. He's left his house 2 times, so very little walking. However, you can still improve rotation, which improves balance and the ability to walk. Because when your clients lose the ability to rotate, especially keep their head looking forward and rotate their trunk and spine underneath their head and around their hip joint, they start to weeble wobble, start to walk more through the frontal plane, and that increases the risk of falling. And the more they have a fear of falling, the less active they become. And Robert and I will be discussing that, and I'll also discuss that as part of our one-day pre-con at Fitness Fest coming up here in a couple weeks. Because again, without the ability to rotate, you won't have the ability to move around your hips. So I wanted to show you a very simple drill, and it doesn't really look like it's going to improve rotation, but what's key about this drill is a couple things. One, we use the principles of the integrative movement system, the ABCs. Align the head and neck at thoracolpelvic cylinder, because when you think about your older client, right, they're usually like this, very kyphotic. Their thorax is positioned behind their pelvis, and their head is forward. So you'll lose rotation when you aren't able to get long. So a lot of our older clients, they're sort of ossified in that position. However, you can still give them a strategy, still cue them to get long, as if they're being pulled up from the backside of the head and neck, and feel as if they're creating space between their ribs. What's great about working with older clients is so many of them have been given up on, and we just think that, oh, they're just old and they're just kind of broken down and they're just kind of how they are. But what's crazy about this is you can take these same cues and strategies that we use with our younger clients or even athletes and use them on older clients, and they actually work. And that's the beauty of having a system like the integrated movement system, or the principles work. So even though your client won't get exactly the same length as you may get And a younger individual still use the same cues. I'm going to set myself up. I'm going to use it's basically called the pull apart. I'm going to hold a rope in the cable machine here, and then I'm going to do a rotation. And I want you to check your own rotation before and after. I'm going to do it on my left side because I already know my left side is more restricted on my two sides. I'm going to do it going towards my left side. So my left side will be forward. But really watch the alignment and how I set myself up. It's going to be a long spine. Feel as if you're creating space between your ribs, maintaining the rib cage over top of the pelvis. And then as I grab the rope, I'm going to rotate slowly and on an exhale to my left side, towards my left hip, the side of more restriction. So I'll check my range of motion before and after because you always want to have an assessment before and after assessment. The other component about this is to use less weight than you think you should be using or your client should be using. Because what happens with a lot of our older clients, of any age, but especially our older clients, when they lose the ability to rotate, so they can't rotate on an axis meaning like straight down through the top of the head, down through the spine, they'll start to shear off the axis, and that's where they start to flex, or they'll start to extend back to create rotation. Again, not great strategies. My buddy Dustin, he's part of our Integrated Movement Specialist Certification Program. Welcome, thanks so much for being on. And Karen, how are you? Thanks for being on as well. So let me step back, I'll show you what this looks like. So we're gonna grab the rope, we're gonna grab it in about this position right here. But again, we always start with our alignment. So align the head and neck, align the thoracolpelvic cylinder, ribcage above the pelvis to the best of your client's ability. I'm gonna grab the rope here, step out with my left leg forward in my split stance position. Again, the weight is relatively light so that I can maintain that length and the ribcage stacked above the pelvis. Before I do that, let me check my range of motion, just so you get a sense of how great this pattern or how effective this pattern actually is for improving rotation. So hands on the pelvis, rotate right, goes very freely, and keep both feet down flat on the floor. Come back to center. Rotate left, much more restricted on this left hip, which is why I'm going to the left side. So again, align the head and neck, align the thoracolpelvic cylinder, grab the cable, step out. Left side goes forward, split stance position. I'm going to breathe in, keeping my hands in front of my shoulders, in front of my chest the entire time. Breathe out, rotate towards the side. As far as I can keep the hands in front of the shoulders. Breathe in to come back. Breathe out to rotate. Breathe in, breathe out, breathe in, breathe out. Stay nice and long. Breathe in, breathe out. I'll do about 3 more repetitions. Breathing in, breathing out. And again, making sure you're not over-rotating through this pattern. One more time. Stay nice and long. Let me do it from the other side. So you can see from the other side, it would be like this. I'd be rotating here, long spine, stacking the ribcage, and then rotating like that. So split stance, rotating, staying long on that axis, rotating, coming back, controlling, rotating, coming back, controlling. So that way the individual is rotating on the axis through their spine and also the axis through their hip joint. So that way they're getting the pure axial rotation. So let me just check to see if I made a difference. Feet back together, hands on the pelvis, rotate right, still feels pretty good. Rotate left, much different. Still not equal to the right, but much different after basically 6 repetitions. You see how much different that range of motion is going to the left. It just feels more free, there's less restriction, and it actually feels more stable on my left foot. And actually my balance actually feels really, really solid on that side. If I did a couple more sets, it would be right on solid. So very simple pattern, very effective pattern to train rotation. It's rotating the entire cylinder over top that femoral head or that hip joint of the forward leg. If you have if your client has a significant asymmetry, then you'll do more repetitions on the more restricted side. And that's key too. You don't want to do the same amount of repetitions each side because then the client is just going to have the same asymmetry side to side, even though their total range may increase. So do a few more repetitions on their more restricted side, so that way you start to open up that side, because the body doesn't like to deal with huge asymmetries. Yes, the body is asymmetrical by nature, but it's when these asymmetries start to become more significant, especially in range of motion from side to side, that's where your clients start to run into trouble, because the asymmetry is too much for the body to deal with and now has to compensate through the low back or through the knee. Hence the reason why so many of your older clients have low back and or knee issues. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Thank you so much for being part of our community. Thanks for tuning in today. Again, I know it's a little echoey today. Next time I'll bring the microphone once I get things unpacked here. And we'll be shooting more videos in this space as well. So thank you for all you do. If you have any questions, feel free to reach out, let me know. I'll answer any questions that you post on the site about balance and even trunk rotation that we talked about today. This is what we're going to be discussing this Saturday on our 2-hour webinar with my good buddy Robert Linkle, Exercises for Independence. Because remember, one of the most important activities your client can do for independence is balance and walking. And Robert will add in how do you train carrying, how do you train squatting and lunging to help improve the activities of everyday life. Super excited to be doing this with Robert because we're going to give you very practical and functional exercises to do for your clients to improve their everyday life. Also, actually I keep forgetting the date, but it's coming up in about 2 weeks. We're doing a pre-con, a full day pre-con. It's basically the integrative movement system. How do you use your assessments to determine your client's suboptimal posture and movement habits? And these are the reasons why your client is tight or has discomfort or can't perform at the levels they need to or want to. From your assessments, that drives and dictates your corrective exercise strategy. So we'll take you through the integrative movement system, corrective exercise strategy, so that way you understand and know and leave with the tools and strategies to help your client create more optimal posture and movement habits. And then finally, progress them into the functional movement patterns for the lower extremities, squatting, lunging, bending. So we'll teach you how to do deadlifts, hinges, and show you how to progress these patterns so that they improve joint health. So if you have clients that have arthritic joints, if you have clients that have joint replacements, how do you help train them and help them improve their function so that way they start getting better? Like my client Joel at 84, he's actually developed glutes at 84 years of age, living in quarantine, basically in quarantine, has left his house 2 times in 4 to 6 months, and he's actually developed better balance, better glutes just from using these strategies that I'm going to share with you and that I've been sharing with you in this past series of Integrative Movement Insiders. So you're going to leave with tons of great information, tons of practical information, the same strategies we teach our clients, same strategies we use in our clinic, the same way we train ourselves. And that's the beauty of having a systematic approach like the integrated movement system, that you're not guessing. You're not just throwing a bunch of exercises at your client hoping they work. You have a systematic way to assess, to address, and to progress your client so that way you become the expert for them and attract more individuals that need, want, and will pay you for your expertise. I'm going to have Mary put the link next to this video, so be sure to look for that. And we look forward to seeing you at the 1-day pre-con or hopefully we'll see you this Saturday for Robert and I. We are doing that 2-hour webinar on exercises for independence. So look forward to seeing you there as well. That's through the Functional Aging Institute, our friends over there. So again, thank you for all you do. Thanks for being part of the solution to the healthcare crisis. And thanks for being that leader that your clients, your community, and that leader that brings people together and shows them that they can be proactive about their health and giving them the real world strategies to be proactive about their health so that way they can come out of this stronger, more resilient, and position yourself as a leader of this industry. Take care. Thanks so much. We'll talk to you soon.